Dr. Tom, how exactly is ocular melanoma diagnosed in the first place?
So first I'll say it's got to be diagnosed by an oncologist. The reason why I mention that is we actually have had people come in from around the world and then told me someone gave me a diagnosis, so they tell our medical team, someone gave me a diagnosis, and like, how? With what data? What diagnostic, options did they use? When you deal with cancer, the diagnosis should be made by an oncologist. So having said that now, so the way I would kind of paraphrase things a little bit is, what are the steps an oncologist may or may not use to help diagnose, the cancer that someone has, let's say, in their eye? So your doctor may do things like an eye exam. And in the eye exam, they may have a light, they shine in. I've seen now some of my buddies more in the ophthalmology world, they're showing me all kinds of cool gadgets that the FDA's approved for diagnosing things with the eye. One of the cool things I've seen is think about a microscope that you look into with your eyes. And as you're looking into it, they're kind of like over on the side looking at the inside of your eyes, but instead of staring at you in front of you, because sometimes that could be a little awkward, like maybe you need to see details, but so you're just looking through this microscope looking device and they're somewhere else reading into your eye, but you feel normal. Like you don't feel like there's anybody staring at you in front of you. So it's more of I would say it's kind of more of an unobtrusive view, if you will. And they could see some pretty cool details. So they're going to have some way of looking at it. The old school way is, the device that puts the light in your eye and they tell you look up or down and do things. Another method is what they call binocular indirect ophthalmoscopy, which is just a bright light mounted on a doctor's forehead, almost like a miner's lamp, and they're kind of looking in that way. Some other methods, eye ultrasound, which uses high-frequency sound waves from a handheld device that produces images of the eye. And the way it's worked is a transducer is placed on, say, you close one eye, and it's going to get some readings. In some cases, the eyelid could be open. A lot of times, what I find is interesting, people think by closing their eyelid that it's stopping everything. A lot of therapies go right through the eyelid, whether it's open or not. Like it's not as much of a barrier as we might think sometimes. Another thing is they could image the blood vessels in and around the tumor, and that's called an angiogram. And during an angiogram, a colored dye could be injected into a vein in the arm, and the dye travels to blood vessels in the eye, and then that's how the doctors could see the areas on the imaging. Another way of diagnosing is a camera with special filters to detect the dye and taking pictures every few seconds or over several minutes. There's another type of imaging test called optical coherence tomography. And the imaging test creates a picture of portions of the eye and different components inside. And then another thing that could be done is a biopsy, where they could actually surgically go in and remove a piece of tissue from the eye, and then they can send that out to a pathology lab to actually look at what is being, what materials there is. Are there cancer cells? What are genetic mutations or alterations in those cells? And so the point is that you can do a biopsy, but it may not be necessary to do a biopsy in order to diagnose the ocular melanoma. In some cases where it's located, it may not be, it might be too much of a threat to someone to do it, so the doctors will look at less invasive methods. Now, in terms of determining if the cancer has spread beyond the eye, so remember we said earlier on that it most of the time is going to spread to the liver. So some of the things that could be done then is a doctor could order blood work, and they could just look at liver function tests or liver enzyme tests. Second thing that could be done is chest x-rays. You could do a CT scan, you could do MRIs, you could do abdominal ultrasound, and you could do PET scans. So there's a lot of options there in terms of what could be done on a diagnosis of the ocular melanoma and where it's spread in cancer. So in terms of the treatment options for ocular melanoma, I kind of broke it down into, several of them, just to kind of give people some examples that you're not locked into a box, like you do have some freedom of choice in some cases. Now, keep in mind where the cancer is and where it's spread. That's critical for kind of determining the best course of therapy or treatment. And this gets back to, having a conversation with your oncologist, maybe other professionals on that oncologist team. And so in terms of treatments, generally speaking, surgery, radiation, medications such as chemotherapy, keep in mind that's always going to be the traditionally recommended options for any type of cancer. Now, in terms of ocular melanoma, the treatment options will depend on the location and the size of the ocular melanoma, as well as the overall health of the patient and their preferences. So it's not just like, hey, I got this cancer in one part of my eye, let's treat it. There's some other variables besides the cancer that have to be taken into account. In terms of, what you would do, small eye cancers may not require immediate treatment, and sometimes the docs may decide to look and see what happens, because if it's so small and the risk of treatment is a greater threat to your health than what the actual cancer presents, then it's kind of like, well, if you're not suffering, we don't want to do something that could make you suffer more right away. So there's mixed schools of thought. What I'll tell you is this: many people come in and they hear they have cancer and they're terrified. They're thinking, man, I got to do something or I'm going to die. And what they're not aware of is that if you could slow the growth rate of cancer, then it may not affect your quality of life at all, and you can live the rest of your life and die of old age as opposed to dying from the cancer. Mm-hmm. So there's a practical aspect here. And so one of the things that this is where monitoring is critical, because let's just say, for example, I had ocular melanoma and I had that at the age of 10. And now we got some imaging that gives me sort of the size and shape and location. And now here we are, and I'm 20, and you image me again, and there's no change. And now we're 30, no change. Now we're 40. Then you would know as my oncologist, hey, look, this thing hasn't changed in 30 years. Just leave it alone because it's not affecting you, right? Outside of let's say the chemotherapeutic options, on the radiation side, radiation involves what's called ionizing radiation, which is basically high-powered energy to hopefully kill the cancer cells. There are definitely more robust methods now where they're far more precise with the application of the radiation than ever before in history. There is some potential damage to healthy cells. People all the time go, well, the radiation causes cancer. Let me give you a little bit of common sense interpretation, though, is that let's assume you got eye melanoma, you get some radiation done for a small spot. The cancer that is created from that radiation treatment may take decades to develop. And if you got something threatening your health right now, don't worry about 20 years when something right now is going to immediately affect you. The most logical thing is fix the problem you have right now, and then go on a diet that reduces DNA damage. Go on a diet that, after the treatment and you have the ocular melanoma around, then start a strategy that reduces the likelihood of cancer formation. And that's like a balanced interpretation of how to get the best of both worlds. What I see happening sometimes, people go, I don't want radiation, it causes cancer. I'm like, but the cancer you have is growing right now. So you're basically saying, I'm worried about the future, so I'm going to let myself die today. That makes no sense when you use logic and common sense. Now, there's outside of, that interpretation thing, people sometimes go, well, how's the radiation delivered? Keep in mind, I'm not a radiologist, not an oncologist, and I don't do this stuff for a living. I'm kind of collecting notes and kind of sharing that so that people have a better sense of things. But they may have some type of device that's placed over the eye, and the procedure is called brachytherapy. And basically, they apply the radiation through a bottle cap that may contain some radioactive seeds. And this plaque that's part of the procedure may remain in place 4 to 5 days before it's removed. So it's kind of like they put something on the eye to deliver the radiation. After radiation is delivered, then they remove this thing that's on the eye. That's one way. They could also use a machine where it's kind of like, I think when most people think of radiation, they think of some sort of high-powered thing that's, guiding like an X-ray machine that's very more focal, guiding the X-rays or whatever, the radiation into your eyes. This type of radiation procedure is usually done over several days. So that's kind of like some ways that radiation can be administered to ocular melanoma. Now, there's also laser treatments, and the laser treatments involve using a laser designed to kill melanoma cells in certain situations. And one of those ways is the laser generates heat, and so that's referred to as thermotherapy. And that involves an infrared laser, and sometimes that laser is combined with radiation. So it's kind of like you're going to do like a 1-2 punch combination to kill these eye cancer cells. Incidentally, the infrared light therapy I'm doing on my shoulder earlier in this show is infrared. So it just shows you that not only can it kill cancer cells, it could also reduce inflammation. So there's multiple applications of infrared therapy, but in this case, it's specifically to kill the melanoma cells. Another way that laser therapy can be used is through the introduction of photosensitizing agents. So what happens is someone may take in a substance. That substance can be natural or synthetic. So it could be a drug or it could be a natural item. And then that substance gets to the eye and then the eye cancer cells. And then when you put a wavelength of light on those eye cancer cells, it basically induces apoptosis or makes the cancer cells pop like bubbles if you're looking at it under a microscope. So it's kind of clever because many people say, I didn't feel anything. So I've seen that done many times. I think that's something people should look at. Now, another option is cryotherapy, or what they call cold treatments. We basically could think of it as you're going to try to freeze the cancer away. I know cryoablation is a current therapy that's getting a lot of attention. The idea is if a tumor is going to damage a tumor, and then somehow your immune cells will find this tumor and kill all the cancer cells inside. I'll tell you that I've seen lots of people get that done, and by itself, I don't know that it's necessarily that much more effective than other therapies, but I think when it's combined with other things, there could be some potential there. I just shared that because a lot of times people say they were recommending, their physician only recommended cryo type of therapy, and I'm like, well, that's kind of like, if I got 5 weapons, I'm just going to use one. You know what I mean? That's not maybe the best approach, I would say. So, that's kind of like a broad array of treatment options.
That's pretty comprehensive. This is why we like to Ask Dr. Tom, and this is the Ask Dr. Tom show. You can get episodes, future past episodes of Ask Dr. Tom at askdrtom.com. I encourage you to go to Causenta.com and get some information about anything you might have been diagnosed with or a family member, and set up a free call, because as you can see, from the technology to the mindset to the applications, there's things at Causenta, whether you're in Arizona or not, that might be able to help you in the situation you're in. Today's episode of Ask Dr. Tom is focused on ocular melanoma. And Dr. Tom, I'm wondering, you mentioned radiation, you mentioned laser treatment. Is surgery ever a consideration due to the location of this cancer in the eye?
Absolutely. Surgery can be considered. But, earlier on in the program, I mentioned that, my interaction with 3 family members of friends, they all had surgery done. And it looked like a good, the initial outcomes were it's a success. They got all the cancer that could be found. And then in each case, the patients wind up passing away at some point in the future. What I would say is there's a lot of options for treatment that oftentimes are ridiculed because they only affect the tumor and they don't affect the circulating tumor cells or cancer stem cells in the blood. Yet ironically, surgery is often administered in those cases, and you'd say, wait a minute, the surgery only affects the tumor. It does not affect the circulating tumor cells or cancer stem cells in the blood. So why is surgery advocated and then these other therapies that could affect the tumor not advocated? In other words, the criticism should be applied to all treatments that only affect the tumor. And I have this suspicion that the reason why surgeries are often done is because it's a lot more money to the institution. If it were me personally and I was on a budget and I didn't have insurance, I would look at the surgical option. I would look at other options that could be done that are not as expensive. And part of my decision making is a balance between my expense on treating myself, the return of my investment, what the expected outcomes are, and what happens when it doesn't work. That's the one question people never seem to ask enough. It's so far we know about cancer is most of the time it's not a home run. Most of the time it's like we got part of it, or it's a failure, or it's a failure. So what people need are centers that have lots of options, not just 3. And unfortunately, sometimes people forget that. They ask a question like success rates or something, and then they always forget that, well, they could be on the other side of that number, right? So if I say 99% success rate, you could still be on the 1%. There's no guarantee you're on the 99. And so a lot of people make decisions off of marketing and not off science. And the science tells us we're all unique, and we got to look at a number of variables to find the right solution. But also, more importantly, on the medical side, if I'm talking to a surgeon and he says surgery is the only way to go, then I would say, all right, what about the cancer cells in my blood? How are you going to treat that? If he says, well, I'm going to have this other guy deal with that to me would be a good option, because they're thinking outside just in the tumor in my eye. But if they say, oh, that's going to be good enough, I would have a concern. I would have a concern because most of the time, if there's a tumor, there's probably cells in the blood already. Because remember, by the time you found that tumor, it could have been pretty advanced. People very rarely find stuff at the early stages. They usually find it later on. So the odds are pretty high to something in the blood. Now, in terms of what the procedures would be involved with the surgery, clearly it's be an operation of some kind. The type of procedure operation is going to depend on a number of factors. First, they're going to obviously try to remove the melanoma. In order to do that right now, they're going to have to remove some healthy tissue. Generally speaking, surgeons are trained not to cut through a tumor. Like, they don't cut through cancer, they cut around cancer. And I've talked to all kinds of surgeons, and they pretty much say the same thing regardless of where they've been educated, East Coast, West Coast, outside the United States. I hear very similar things about this is how we were trained. So I translate that to, it's kind of like a universal rule, although I have no data that says, hey, this is how everybody's trained. But generally speaking, surgeons know what to do when it comes to surgery. That's why they're surgeons. So the issue isn't, I think so much about the removal of the tumor. It's more about what part of the healthy tissue is going to be damaged or affected from the surgery. That's maybe more of the greater concern. And in some cases, if it spreads so badly, they may have to remove the entire eye. That process is called enucleation. And it's basically for large eye tumors. In other cases, there may be smaller parts removed, and there may be some sort of implant or other device left to help the eye function. In the cases I mentioned historically, all of them involve complete removal of the eye because the cancer had spread. So if nothing else, this is another point to make that people need routine checkups, between your eyes, your vision, your hearing, your dentist for your mouth. These are things a lot of times people tend to say, oh, I don't feel anything, or I could see fine. But the slow loss of vision over time is not obvious. Slow loss of hearing over time is not obvious, or change in plaque in your mouth over time. And these are not so obvious things. But if someone's going to a proper professional, they'll tell you, look, your vision's going down below what's acceptable, or there's plaque buildup, or your hearing. In other words, there's a problem somewhere that needs attention. And then you would know to get it fixed before it becomes a more serious disease type of process.
We're talking with Dr. Tom, and today's topic is ocular melanoma. We've talked about diagnosis. We've talked about the definition. We've talked about the treatment options, and your options you can explore with Causenta, with Dr. Tom and his team at causenta.com, CAUSENTA.com. You definitely want to make sure you follow them on Facebook And visit the website and set up a call if you or someone you know has been diagnosed with this cancer or any others. Today's topic, ocular melanoma. And the final question we have for you, Dr. Tom, and we have about 5 minutes or less to really dig in if you need to. Are treatment options different for patients with metastasis versus primary ocular melanoma?
And so the simple answer is yes. So just for sake of clarity, when there's metastasis, that means the cancer spread around the body. It doesn't necessarily mean everywhere, but it's gone, past the eye. When it's primary ocular melanoma, we're talking about the cancer stayed within the eye. Now, one point I will make is there is no perfect test for cancer. There's no imaging, there's no blood test that everyone around the world agrees is perfect. So there's always going to be potential that, it has spread beyond what we could find because there is no perfect test. Generally speaking, if it's cancer only within the eye, you're going to look at local treatment options, meaning, some of the stuff we mentioned earlier, like irradiation, a laser, perhaps surgery. If the cancer is spread beyond the eye, then your oncology team is going to have to consider what are they going to do. Are they going to do surgery plus something else? And let's say if it's the case of there's been a tumor formed in the liver that started, from the primary cancer in the eye, there may be options to do 2 surgeries, one for the liver, one for the eye, and then some other therapies to follow up. So there definitely can be differences in the treatment options. And as I kind of mentioned earlier, I always encourage patients to, the conversations they have with the surgeon is, what are we going to do with the stuff outside the tumor, meaning the stuff in your circulation? And then what do we do when that doesn't work? Those are really critical questions because it helps the patient to see, am I at the right place? Because if they say, we're going to do surgery, we're not going to do anything else, and then after that, there's nothing we can offer you, then you got to decide if that's the right fit for what your long-term goals are. Because if your goals are to live, and it can only give you one option, that may not be the best, may not be a good fit for what your goals are.